Welcome to Prime News. Jen Pellegrino is off tonight. I'm Betsy McCaughey.
Betsy, it's great to see you, and I'm Mercedes Schlapp, and we've got a packed show for you on this Friday night, so let's get right to it. More and more blue states are dropping their indoor mask mandates. That includes some that were the most restrictive of the pandemic, states like New Jersey and California. But many have yet to drop those mandates for students, like in New York and Illinois.
The exception is Nevada. Nevada chose to end all indoor mask requirements, and guess who's celebrating? School children, who are the least vulnerable to this virus and most harmed by the masks.
Starting tomorrow, we don't have to wear masks anymore!
Let me tell you, Betsy, those are future Republicans, I tell you. That's so fabulous to watch. I mean, what a victory for these children. But this is a step in the right direction. As we know, the country is shifting away from draconian lockdowns and mandates, not the White House, though. And we learn to live with COVID. That needs to be the next step. The left, however, preaches to follow the science, and even that is catching up too. We just saw today that the FDA has delayed its advisory panel meeting to consider the Pfizer vaccine for kids under 5. The agency says they want to see more data. I got to tell you, as a parent of 5 girls, some of them little, I'm so glad that this decision happened. And I think, Betsy, most parents have to agree with this.
You bet. That's right. And joining us now to offer his expertise is renowned cardiologist and epidemiologist, Dr. Peter McCullough. Dr. McCullough, thank you for joining us.
Thanks for having me.
1 year ago, the CDC, I call it the Centers for Disaster and Confusion after what we've gone through, the CDC did a study of 169 Georgia elementary schools. Half had mask mandates and half didn't. And when it was all over, there was no difference in the infection rate between the schools with the mandate and those without. Proof that they should have never required those masks in the first place. But 30 days later, the CDC reversed itself and kowtowed to the teachers' union. So, Doctor, what do you think the long-term impact of these unnecessary masks has been on our kids? What's the fallout going to be?
You know, parents are outraged. We learned pretty early in 2020 that masks were going to be ineffective in controlling the pandemic. There have been 12 randomized trials in respiratory diseases, 2 studies in COVID-19 specifically, and then the ecological study you just mentioned. They all showed no impact. Masks should have been definitively dropped as a public health measure. As we learned, the virus did not spread from asymptomatic person to asymptomatic person. So now, with nearly 2 years of masking, some children have had actually difficulty in terms of forming words, recognizing facial expression, and our psychologists and psychiatrists have told us that the damage may be permanent.
Yeah, I mean, that's just so unfortunate. And Dr. Fauci has basically been wrong this entire pandemic. I'm not surprised yet that he still has his daytime job. But in a new interview with the Financial Times, I got to ask you, it seems like he's coming around. He told the outlet, quote, "I hope we are looking at a time when we have enough people vaccinated and enough people with protection from previous infection that the COVID restrictions will soon be a thing of the past." He went on to say, "We're certainly heading out of a difficult phase of the pandemic and hopes restrictions would end by the end of the year." I was shocked when I heard these comments because I think it's one of the few times he's actually acknowledged natural immunity, despite the fact that he's been fighting against this, not talking about it, and only pushing the vaccines as his comprehensive solution in combating this pandemic. What are your thoughts about what he has recently said?
The emergency phase of the pandemic is over now. We're through the big Omicron outbreak. We're on the back slope of it. It was a very tall but narrow outbreak, about 6 weeks in duration. He has it partially correct that once someone's recovered and they have natural immunity, they are protected against severe disease, even if the new variant comes along. Unfortunately, he's not right about the vaccines. The vaccines have never stopped transmission. In the randomized trials, they never reduced hospitalization and death. We have evidence across the world that the more countries have vaccinated, they've prolonged the pandemic, they've increased the number of cases, and they've increased mortality. So the worldwide vaccine program has backfired. Now's a great time to drop all the mandates and actually pause the current vaccines on the market, since they provide no credible coverage against Omicron.
Dr. McCullough, you have watched this from the beginning, and we all agree that this isn't the last pandemic. We're in a world now where viruses attack frequently, with increasing frequency, especially in this country. So what have you learned over the past 2.5 years that we should apply when the next one comes along?
We should never have the CDC and FDA go out of their usual roles and lead a vaccine program. That's been a colossal disaster.
Yeah.
The FDA is supposed to be a safety watchdog organization. The CDC is an investigational outbreak organization, and NIH is the government funding agency. What we need to do is we need to bring in teams of experts, external experts that are willing to volunteer their time to help the government work in collaborative teams along the areas of contagion control, early treatment, late treatment, and vaccination in order to get it right. Because what we've had right now, as you said, has been a series of pandemic crisis blunders by our public servants. They've very much disappointed us. And now we have a deep dive to basically realize what went wrong. We have a lot of evaluation to do on vaccine safety and lack of efficacy.
Right. Well, Dr. Peter McCullough, we really appreciate you speaking up, because I know that so many doctors have been shut down. They've been canceled because they have a dissenting view, or just simply for asking basic questions about how the bureaucracy and the government has managed this. So thank you so much for joining us.
Thank you.